One person dies every 19 minutes in the United States due to prescription drug overdose. Hydrocodone, a prescription painkiller known by brand names such as Vicodin, Norco, and Loratab, was dispensed 1.2 million times to Medicare patients in Georgia, according to federal records. That was in 2012. Hydrocodone, a class of painkillers known as opioids, are dangerous, habit-forming, and subject to abuse. First, I want to shine light that some physicians in the country are trying to stop the overprescribing of narcotic painkillers. Schedule III drugs have a moderate to low dependency, according to the United States Drug Enforcement Act. They include Tylenol, codeine, and anabolic steroids. Schedule II substances are more dangerous, habit-forming, and potential for severe dependency. Among drugs classified as Schedule II are codeine, methamphetamine, oxycodone, Adderall, and Ritalin. The federal government has already reclassified hydrocodone as a Schedule II drug rather than Schedule III. We are making positive changes in the right direction. Since hydrocodone is now a Schedule II substance, patients are required to have a physician actually write them a prescription and they must take it to the doctor. No longer can it be given orally or faxed over. When they need a refill, they must revisit the doctor to have a new prescription written. On the other hand, it is easier for a doctor to write a prescription than to actually explore options to help their patients with pain. CNN chief medical correspondent Dr. Sanjay wrote in an editorial, "It is easier for patients to keep taking these pain medicines instead of searching for alternatives themselves. Both of these must absolutely change." Thus, Georgia State Bill 125 was introduced that would grant physicians' assistants the ability to write prescriptions for hydrocodone compound products. Oh no, a physician must delegate. They must actually include it in the physician's assistant job description, the ability to write the prescription. I see this as a danger or whatever. This prescription should be only left up to the physician since they are the one managing the patient pain. Prescription drug order. If the state were to pass this bill, it would give physicians' assistants the authority to issue single, non-refillable prescriptions, meaning they cannot have refills on this prescription. If the patient is under 18 years old, it cannot exceed 100 milligrams. If the patient is over 18, 300 milligrams. So, at least for 5 days. Consequently, in recent years, hydrocodone has become a street drug, meaning the person that the medicine is prescribed for sells this on the street. They use the pill for euphoria, to get high, and many times they snort it, eject it, and that's where it's leading to the overdose deaths. If more people are granted this prescription, that means the physician's assistant are allowing more of this drug on the streets. I know treating acute pain is in the scope of action for a physician's assistant. However, some physician's assistants they cannot recognize when a patient has become chemically dependent on this drug. I am not saying people do not use it for their pain, but many are selling these pills on the streets and it's killing a lot of our citizens. They pocket the cash and turn around and get another prescription the next month. We have to stop the cycle. Since many people are abusing and misusing the drug, I feel there should be a tighter grip on who dispenses it, leaving these tasks to physicians only. We need a balance of who this drug is being prescribed to. I'm concerned with the abuse and misuse. In conclusion, taking the extra precautions by allowing only physicians to write prescriptions can help reduce the number of drug overdose deaths. Thank you.